Hey there, it's January 12th, 2022 in British Columbia, Canada. I was listening to Adrian Dix and Bonnie Henry yesterday, BC's top health officials, and they provided some information with regards to hospital and ICU bed utilization. And I just wanted to take a look at that data along with some other data points and get a more comprehensive look at COVID's overall impact on our healthcare system. A lot is also obviously being made by politicians and news pundits lately around the unvaccinated and their impact on our healthcare system. So I also wanted to take a look at some of that data.
Of those 9,229, 8,821 currently have patients. That's 95.6%. In addition, we have 2,353 surge beds. At the moment, 580 of those have patients in them. With respect to critical care, as you know, we have a base bed number of 510, and 448 of those beds are currently filled with patients. That's 87.2%. And we also have 218 critical care surge beds. 16 of those are currently in use.
Okay, so let's dig in. According to the BC COVID update website, we can see that 32% of recent hospitalization cases were from unvaccinated people. Partially vaccinated accounted for 3.6%. I created a group by summing those two, which was 35.6% of recent hospitalization cases. The fully vaccinated accounted for 64.4% of recent hospitalization cases. So if we take a look at the BC COVID dashboard, we can see how many people are currently hospitalized with COVID. So now we know the total number of people hospitalized, the total number of people hospitalized with COVID, and we can get a really good idea of what percentage of those people are vaccinated versus unvaccinated. So this is chart 1. And we can see here that unvaccinated COVID patients are taking up just under 2% of BC's hospital beds. Now, I couldn't for the life of me find any recent government information on critical care cases broken down by vaccination status. It is definitely a bit strange, but I did find this Global News article here that said recent critical care cases were 60% unvaccinated versus 40% vaccinated. So we'll have to go with this. Using the same basic arithmetic we did with the hospitalization cases, I was able to produce chart 2 here. And we can see that unvaccinated COVID patients are taking up somewhere around 12.5% of total ICU beds. I'm going to jump around a little bit, but we can come back to these two charts later. If we take a look at Canada's epidemiological update site here, we can see hospitalizations and ICU admissions broken down by age since the beginning of the pandemic. Now we're going to take those data sets and we're going to superimpose those on the recent BC ICU and hospitalization cases, specifically on the unvaccinated group, so we can get a very rough idea of what the risk profile looks like for an unvaccinated 35-year-old, for example. So here's my estimate of unvaccinated hospital cases broken down by age: 0 to 11, 12 to 19, 20 to 29, 30 to 39, 40 to 49. Here's everybody 39 and below. Here's everybody over 60. Now here's my estimate of unvaccinated critical care or ICU patients broken down by age: 0 to 11, 12 to 19, 20 to 29, 30 to 39, 40 to 49. Here's everybody 39 and below. Here's everybody over 60. Just a couple of very important points to make here on these past two charts. First, these unvaccinated sections are not excluding people with health issues or other comorbidities. If we were to get reliable data on that and separate into further subgroups, I think that we would see that the rough percentage of beds likely occupied by otherwise healthy unvaccinated people under 40, for example, would be significantly reduced. Second point, these unvaccinated sections possibly include incidental COVID patients or people who are in the hospital for something other than COVID but tested positive nonetheless. I don't have any reliable data on that at this point, but I just want to flag it as a real possibility that could further shrink the size of these sections. Now, for some reason, Stats Canada has not yet released their 2020 death database information, which I think is a real shame because this is some of the most important information that they could provide us, because it really gives us an understanding of what is causing death and ultimately suffering for Canadians. Now, with our health officials making massive changes to the way our society functions, whether that's closing gyms or lockdowns or postponing schools, and I think ultimately making us a less healthy society. I think we'd be wise to keep an eye on some of this information, because ultimately reducing COVID numbers at the expense of further health complications down the road is really not a solution at all. And this is really the point of what I'm trying to do here. And I really don't want people to think I'm trying to minimize COVID deaths here. I'm frankly doing the opposite, because I don't think some of these other health issues are getting enough airtime lately. So here were the leading causes of mortality in 2019. Cancer, 28.21%. Heart disease, 18.5%. Accidents, 4.84%. Cerebrovascular disease, 4.81%. Chronic lower respiratory disease, 4.51%. Diabetes, 2.43%. Influenza and pneumonia, 2.43%. Alzheimer's, 2.17%. All other causes of death combined, 29.36%. Now we can see on the Canadian COVID dashboard that there's 30,862 deaths since the beginning of the pandemic, which worked out to approximately 46 deaths per day since March 15th, 2020. Now we can see what it looks like with those two data sets combined. COVID takes up just under 6% of the total chart here. Looking at it another way here. Now we got our last three charts here. We got the Canadian COVID death broken down by age as found on the Canadian Epidemiological Update website. 0 to 11, 12 to 19, 20 to 29, 30 to 39, 40 to 49. Here's everybody 39 and below. Here's everybody over 60. Now we've got the percentage of British Columbians here that are fully vaccinated versus not. And now if we compare that to the recent BC COVID cases broken down by vaccination status, we can see that there's really not much of a difference here.
And this is one of the challenges that we're facing right now with Omicron, because people who are vaccinated do have good protection, good strong protection against hospitalization and severe illness, but we are getting infected at a much higher rate. And we see that in the numbers that we see every day, where the numbers of cases, the percent who are positive, reflect the percent of vaccinated people in the community.
Now, putting this together, I think it paints a very bad picture of anybody trying to demonize people who are exercising their right to body autonomy, whether you like it or not, especially those people who are in low-risk categories, those who are healthy, fit, and get lots of exercise. I don't see the correlation between the hatred and vitriol that's been thrown their way and their impact on our overall system or ability to spread the virus. I don't see the correlation here, and I think some of the stuff that's been coming out of Justin Trudeau and the Premier of Quebec is just horrendous in my opinion, but everybody's entitled to their opinion. Anyways, I hope this was informative. Share it around, please. Thank you. Take care.